Hello, we are so glad you're joining us this evening. I'm Hartford Healthcare's Tina Verona. I am joined by Dr. Abigail Chua. She's a neurologist and headache specialist at the Hartford Healthcare Headache Center. Dr. Chua, thank you for joining us.
Sure, thanks for having me.
You bet. Well, June is Migraine Awareness Month, and this really is an exciting time for you and everybody in the office and for patients. We are talking about a drug and then a new class of drugs that will soon be coming out for migraine sufferers in the treatment of migraine, something to prevent migraines. This is huge.
This is huge, yes.
Tell us about this new drug.
So what makes this new drug, this new class of drugs called CGRP monoclonal antibodies so exciting is that it is the first time we have ever had a headache treatment that was specifically designed for migraine itself. Everything we've been using up until now has been used to treat other conditions such as high blood pressure, depression, seizures, but this is the first time we're directly attacking migraine.
And this is just recently the first FDA-approved drug.
Absolutely.
And we're literally like honing in on the molecule, right?
Mm-hmm. Yep. So the molecule is called calcitonin gene-related peptide. And it's really interesting because studies on this molecule show that if you actually inject it to someone who has migraine, they will get a migraine headache. And if you inject the same molecule into someone who does not suffer from migraines, they will get a headache, but not a migraine.
But not a migraine.
So it's very closely tied. So all the research is showing that this molecule can either cause headache, or if you block it, we can prevent headaches.
So talk to us about how the drug works. Now, this is something that the patient administers at home through an injection, is that correct?
Yes, so the injection is very much like an EpiPen. So, you know, when people hear injections, they get very worried and think there's like a needle. There's nothing you have to draw up. There is no needle that you actually have to see. It's about this long, and you can place it on your leg or area with a lot of muscle and just hold it down, and the device does it for you.
And now we're also talking about pretty instant benefits to this in terms of maybe a month or so?
Yeah, so pretty quickly. So, you know, whenever we start a patient on preventives, we usually say that headache medicine takes time. Most preventives on average take 4 to 6 weeks to start doing anything significant in terms of headache benefit. But Aimovig, which is this new medication, the studies showed that patients were actually having good response after 1 or 2 months. So that is very fast.
That is life-changing. You know, for patients out there who suffer from debilitating headaches, who literally cannot function.
Absolutely.
And this is just a real game changer for this group of patients. How does it work? So they administer it like an EpiPen. What happens when the drug enters the body? Where does it go? What does it do?
So this specific medication, the class itself is called CGRP monoclonal antibodies, and there's 4 out of, well, there will be 4 out in the market. There's currently 1 FDA approved. The 3 that we're waiting for are going to be attacking the molecule itself, so CGRP. But the one we have now actually blocks the receptor. So the molecule is still there, but it can't actually do anything because that door is locked. It cannot get inside. It can't do anything.
Right, so it's blocked at the receptor part of it. The next group of class of drugs that come out are going toward the molecule?
Yes.
Is that right?
Yes.
Okay.
Yep.
So what's the difference there? So is it more benefit attacking the molecule or the receptor, or just about the same? What's kind of the difference there?
Well, I think the difference is, well, we don't know. It's brand new, so, you know, research is different than real life. All of the entire class has potential to be life-changing for migraine patients. And we're just going to have to see which type is better. They all can decrease frequency of headache, but what goes along with that in terms of how people are responding, what other side effects or adverse reactions they may have, we have to kind of see that.
Right. It's still almost like a trial in and of its sense. Now, so far, it's been pretty popular in your office. You've actually administered it to dozens of patients. Is that correct?
Well, we see a lot of patients who are very refractory, meaning that they have tried lots and lots of treatments in the past, or they have medical conditions that prevent them from trying some of these medications that we currently have. So when Aimovig was released, I mean, everybody was excited. The providers were excited, patients are excited. So, you know, it's available, so why not? We have it now, we have to use it.
And so the ideal patient, obviously someone who suffers from migraine, but for someone who has had failed attempts with at least 2 other prior methods that have not worked in the successful treatment of their migraine would be an ideal candidate for Aimovig?
Absolutely. And when we say not worked, we don't mean that it doesn't have to work at all. Sometimes patients get a little bit of relief, but we can't push up the dose because they're having side effects that prevent us from doing so. So we've kind of reached this wall where we think they can do better, but we can't use those medications anymore. So maybe Aimovig will come in and give us that little extra jump, you know, give them at least 2 to 8 less headache days a month, which for headache patients is gigantic.
That's big. And that's a big deal for providers too, because you feel like, you know, you are trying to help patients and you want to, but and you're trying different techniques and it's not quite working, or maybe they get some reprieve. And now this comes along, and it's kind of like the knight in shining armor.
It's very exciting.
Yeah,
I mean, I have to say though, you know, we are all very excited about it, and it has potential to really improve a lot of lives. But I want to make it clear, and I tell all my patients this: it is a preventive. It is not a cure.
Right. It's a big difference.
It's a big difference. Yeah. So while you can have significant benefit, I can't ever promise, and I will never promise that you will never have a headache again. Until that cure comes along one day.
And hopefully it will soon. But preventive is a big deal for migraine patients, because at least if they know they can prevent an onset of a migraine, I think that is just, especially with triggers, or if they get headaches at certain times of the day or in their life, this is you know, they can have somewhat of freedom.
Absolutely. You know, we have patients who have headaches every single day, have migraines every single day. And a lot of these people are working and have to call out of work. And you know, no one has unlimited days off of work. So if we can say decrease their headache days by 8 a month, that's 8 days they can go to work. 8 days they don't have to worry about calling in, getting in trouble, getting written up at work. So you know, it's great.
And just your quality of life. I mean, and that's in and of itself is pretty priceless. Marilyn says hi. Hello, Marilyn. Thanks for joining us. We are joined by Dr. Abigail Chua. She's a neurologist and headache specialist at the Hartford Healthcare Headache Center. Marilyn, we invite you to ask a question, or anybody out there to ask a question. We know so many people suffer from migraine. What are the statistics now across the U.S. in terms of
39 million men, women, and children.
Wow, that's a lot. So chances are either you suffer from migraine or know somebody who suffers from migraine. And we all know that can be debilitating. The next group of drugs, are they coming out one at a time, or is it all 3 at once? Do we know? And do we know when they might be coming out? I know the studies are done.
The studies are done. We are at the whim of the FDA. So we will see.
So hopefully soon, but at least for now we have the Aimovig. So when you talk about how many times a day would somebody have to do an injection when they...
Once. So it is, the new medication comes in 2 doses. It either comes in 70 or 140, and each dose is 1 syringe, so 70 in each one. So in terms of the studies, the benefit was a little bit better with the 140. Side effects were pretty much equal. So it's up to the patient and their provider to kind of decide, you know, which one may be right for them. So it'd either be 1 injection or 2, once a month.
Once a month. So that's not much of a commitment for that kind of return.
And for our center, we are offering patients a chance to come in, learn how to do the injections. Not everyone has done injections for migraines before, so you know, we can show them how to use it. We have demonstrations that we can do. We have little demo kits. Also, the company is sending out nurses if patients want it to show them how to do it. There's also a video online that patients can watch.
Oh, that's great. So there's no questions there. So the FDA approved this for Aimovig about 3 weeks ago. So
May 17th.
We're saying, you know the date, of course. So we're talking about probably a month. So you started prescribing this to patients about 3 weeks ago. So you probably haven't really seen any results as of yet. Maybe another week or two
I
from
think it's
patients.
a little too soon.
Too premature.
So when it first got FDA approved, we had a lot of patients coming in, a lot of patients calling in, asking questions. Of course, this is a brand new class, so we don't just prescribe it and say good luck. We want to bring them in. We have a conversation about it. That takes a little bit of time, and then the company itself will call the patient, and then they will hear from them within 1 or 2 days, and then potentially get the drug a couple days after that.
Wow, that's great. We have a question from Allison. She wants to know, is this covered by insurance and the cost?
Okay, so that's a great question. So again, it is brand new, so we don't exactly know what insurance companies are going to do yet in terms of cost. However, anyone who gets a prescription now will get 2 free months of it from the pharmaceutical company. So they're offering 2 free months. And again, patients may see benefit within 1 to 2 months. So those 1 or 2 months free are really, really great. And then at that 3rd month, we don't know.
Right.
We're thinking that it will be covered. We just don't know in terms of co-pays and those kind of things how much it's going to cost. But again, the company is really creating a lot of access so that patients can get this. There is going to be a co-pay program for them.
Right, and it sounds like just the training to bring patients up to speed with this is quite robust. I mean, there's training manuals online and videos of how to do. Is it difficult for somebody to do this on their own?
It is absolutely not difficult. And, but it's a scary thing injecting yourself. But it is, again, not a needle that you can actually see. It's not like getting your flu shot. It is a covered syringe. It looks literally like a plastic tube. You just hold it down, push, and it does it for you. You just hold it.
And where do you administer it?
You can do it on your thigh. You can do it on your belly. It just depends on the patient's preference.
It depends on the preference. Were you surprised when this sort of new drug and these new class of drugs were coming out? What was kind of your reaction to this and say, wow, I can really offer some patients some new hope here?
Well, so I have migraines myself, so I understand what it feels like, and I have to tell you, I was excited not only for myself but for patients. I know, personally, a lot of people in my life have migraine as well, and they can't tolerate a lot of the medications that are currently out there. So this is great for a lot of people.
What about for folks with migraine with aura? Is this something for?
It was studied for that class of patients as well. So migraine with or without aura.
Is there anybody that would not be able to benefit from this?
So there are no absolute contraindications to it right now. However, women who are pregnant, trying to get pregnant, we're really discouraging them from, if they're pregnant, not getting the drug, and if they're considering it, not getting the drug until they really decide whether or not they want to.
Well, right, and plus the side effects are unknown at this time too.
Well, side effects, we do know that the most common side effects are injection site reaction, because again, it is an injection, so there's going to be some reaction there, and also some constipation. But other than that, we really didn't see any side effects.
And would that side effect be just after the injection, or could it be, a week or 2 after the duration, or just right after the injection?
The injection site would be right at that moment.
It would be right at that moment.
I mean, it depends how sensitive someone's skin is, obviously, but it's nothing long-lasting.
Okay, we have another question. Yolima, I hope I'm saying that right, asks what she needs to do to get the 2 months free.
So first thing you need to do is talk to your provider, either your neurologist, or if you have a headache specialist, definitely talk to them. There are forms that they have in the office. They can help you fill it out. And it's important you fill it out correctly because it's multiple pages with lots of very small boxes. So definitely talk to them, get them to help you fill it out so you know exactly which ones to check off. Also, it has to be prescribed to you. So it's not just available, online. We have to get a provider to prescribe it. So talk to them. If you don't already have one, there's 3 headache centers in Connecticut that you can go to. We have locations in West Hartford, Southington, and Waterford, and we are accepting patients, and we're happy to help.
Yeah, and I know that for new patients, for the process to fill out that form, it's not just a single-page form. What is it, like 19 or 20 pages? It's
our new patient questionnaire. You're talking about the infamous questionnaire. Yeah. So we have it's a long questionnaire, but it is actually very important. Yeah. Headaches are complex, not just migraine. There are 300 different types of headaches out there, and you cannot really tell which one a person is having with a 5-minute conversation. Also, a lot of these patients we're seeing are having headaches for years, multiple years. So it's impacting more than just their head. It's impacting their life. It's impacting their health. So we need to know all of that and know all the medications you've had so that we can treat you effectively.
And it's not a one-size-fits-all with migraine, too. I mean, there's so many variables and factors that affect each and every person. So it is so vital to not only answer every single question on that questionnaire, but truthfully.
Yes.
Because that is the only way that you're really going to get up the proper diagnosis and ultimate treatment.
Yep.
And diaries are important too, right? You encourage patients to do that and to bring them in at what time they're getting headaches and what they're doing, and to determine triggers.
Absolutely. So we have several types of headache logs available at the Headache Center. They're also available on your phone. So Migraine Buddy is a common one people use, but there are so many other ones. You can just go online and look up a headache log or headache diary, headache calendar, and they help you track your headaches, because it's honestly really hard to remember how many headaches you're having. You remember the bad ones, but after maybe a couple days, couple weeks, you forgot about it because you're feeling fine. But every single headache counts, so a calendar will help you track them.
Yeah, for sure. Now, the new class of drugs that are going to be coming out, there's 3 others that are part of this group, right? And that's going toward the molecule to attack. When would you possibly prescribe that one over the other one to someone? How would you know maybe this one might be better than Aimovig?
Well, that's a great question. So the other medications are all not injections. Some are actually have to be administered in the doctor's office or intravenously, so not injection but IV. It would really depend on the clinical situation, what the person's experienced before in terms of availability. Can they come into the hospital? Would they prefer to do this at home? Those kind of things. It requires a conversation.
And could somebody be who maybe has had failures of maybe 2 or more treatments, or that have really tried literally everything? Could that be an option for somebody like that?
I think all of the CGRP monoclonal antibodies are going to require patients to try other things first.
Right.
That's going to be a requirement from insurers. So also it makes sense. You know, these medications are brand new and also potentially exciting, but the other medications we have can also be effective. Right. So maybe you don't want, not everyone wants to jump to an intravenous treatment or jump to an injection. There are natural supplements we can try. There are other prescription pills we can try. Lots and lots and lots of options.
Right, and that's the good thing about at least migraine and the treatment of migraine. It has come a long way, and you certainly don't have to live with it or suffer with these debilitating headaches. And new class of drugs are continuing to come out, and hopefully the FDA will approve those drugs soon. Do you anticipate that happening?
It's going to be, yes, it's going to be soon. Yeah.
Yeah. Yeah. So exciting stuff. Dr. Chua, thank you so much.
Sure.
We appreciate it. It's always a pleasure to have you on. And
I do want to say one plug, though, so everybody knows. So again, it's Migraine and Headache Awareness Month. So if you look online, if you go to the American Migraine Foundation, American Headache Society, if you go on Facebook to the Move Against Migraine Facebook page, the patients and providers, everyone is kind of getting together, sharing their stories, really learning from each other right now. It's a great time for people with headache and migraine. So look around your social media, they're out there. Also, July 21st is the longest day of the year, and it's also Migraine Solidarity Day. So there is a movement right now where they're doing shades for migraine. So they're encouraging everyone to wear sunglasses, you know, where you wouldn't normally wear them, maybe indoors for a brief period of time, just to kind of show your support for people who have migraine. So it's kind of exciting. It's a little bit fun, brings everyone together.
Yeah. And
so
it's kind of like a gigantic support group, if you will, for people with migraine.
Yeah.
And I know one other thing, too, is when you walk into the headache center, there is dim lighting.
Yes.
As you're talking about sunglasses, and that's so important. I mean, we're sitting here in the bright lights. I don't know how that's working out for you, but I do know that at the headache center there is that dim lighting, and it's just those little things that can probably make such a big difference in and be impactful in someone's life. So thank you so much for sharing this. New hope out there and promising results with this new drug. So we're going to have you back to find out how your patients are doing after this, and we look forward to the FDA approval of these other class of drugs coming up. Thank you so much, and we thank you for joining us. I'm Hartford Healthcare's Tina Verona. We'll see you soon.